Chris, you're back. So I hear you should have just stayed all day.
I know.
Where'd you go?
Yeah.
Oh, cool. And she was here this morning. Oh, you were here, and then she was here for me. It's like, oh, Viola. And then you go to well, thank you for that dedication. That's just the girls' baby. And I might raise that a little bit just so I can see if there's anybody. Yes. Most people know they can. Yeah. Is there anything you want me to say as I introduce you? I'm just going to say this is our last Healthy Living series for February, National Heart Month. So March is Mindfulness. Mindful March. There we go. Yeah. Oh, that's right here. This is good in person. I'd like them to see it. And Facebook Live. Yes. I was wondering how you guys knew each other. All of how fun. All right. Well, we're going to go ahead and we'll get started. And so hi from Vessel Health to our in-person attendees and everybody out there in social and Facebook and Zoom. Thank you for coming. I think you know me, I'm Sally, and we have our last Healthy Living series tonight. This is National Heart Month, so we've been doing a great job of just educating and getting people together to find out more and more about the things that we can do that are more preventive. And tonight we have a special panel of guests. We have Denise Cavner, who is part of our lifestyle team. Yay! We have Ashley Meek, our nurse practitioner. Yay! Magnesium from Epigenetics, one of our natural supplement line. So I'm going to give it over to them and thank you all and take good notes.
Yes. All right. Well, good evening, everybody. Thanks so much for being here. As Sally said, I'm Denise. And so I am part of Vessel Health Lifestyle Team. My degree, I have a master's in psychology, and I'm a mental health specialist. Along with that, when I came out here, I studied to become a clinical herbalist, and I study Ayurveda. So I have a different view on health. I'm also a martial artist. I have a second degree black belt, and so I'm pretty well-rounded in health and trying to keep the body healthy. But I don't know everything, and I thought, who does, right? And so, I brought the experts in to help talk together about what heart health looks like. And so we're going to have a conversation. We're just going to be up here having a casual conversation. We want you to ask us questions, whether you're in Zoom, whether you're in person. Stop us if you have a question as we're talking, or if you want to take notes and bring us back to, something that we talked about that you need an answer to. So I'm going to let my guests introduce themselves.
So I'm Ashley Meek. I shouldn't have gone after you. Like, you do. Oh my gosh, you do so much. Anyway, I'm going to be a lot more boring compared to Denise, but I'm one of the nurse practitioners here at Vessel Health. I have over a 10-year background in nursing and now a nurse practitioner. So I recognize many faces, and I've probably seen many of you on Zoom as well. So that is my role. And I'll just add a little something. I love my dogs and my cat, and I love doing outdoor activities. So a little fun fact.
My name is Magda. I have a bachelor's of science in biochemistry and second major in Spanish. And I am a functional medicine consultant with Zymogen. So I provide all the natural supplements to Vessel and several other practices around the state. And so that is my job, to really provide all my practitioners and their patients with the best quality supplements, and I have all the answers for them, for hope to.
Nice. Yeah.
So we have a tentative schedule or syllabus to go by, just because we wanted to make sure that we had some talking points And we wanted to give you information on what you could do to keep your heart healthy. And one of the things that I think you all know this, but we're not always really good at practicing it, is exercise, right? So the heart is a muscle, and we want to make sure that we're strengthening that muscle every day. You have worked out before, and I know some of you have worked out and then you've suffered like an illness, right? And you've had to stop a week, 2 weeks. And how long does it take for that muscle to fade and go away, right? The heart is the same thing. So we have to keep working it. And so one of the things that we do so well here at Vessel Health is we provide programs for you to keep that heart healthy. Exercise, yoga, walking classes, different ways to keep that muscle pumping. But there's other things we can also do to keep that heart strong. And so we're going to have that discussion too. So anything you'd like to add?
Oh, I'm sorry.
We're gonna have that discussion.
Well, and I know we had, and we'll talk more about this in terms of eating. So Denise mentioned exercise. I think about in terms of lifestyle, it's healthy eating. So we'll go into that a little bit more in depth. And in talking about eating should be how we obtain most of our nutrients, but sometimes we need a little help and so we need to supplement with some of our products here, which
so I'll be able to provide some insight on the best products to take and when and why you should be supplementing and if you even need to be supplementing, because not everyone needs to take every single supplement on this table.
So I had this question. So I feel like I'm pretty healthy, but I kind of wondered, could I have a heart condition and not be aware of it? I mean, does everybody know if they're suffering from a heart concern? Is there something we could do to maybe become more aware of our heart health?
Yeah, so I think here, especially here at Vessel Health, we kind of work in a pyramid, right? So the bottom of our pyramid is lifestyle based, like how well we're eating and how well we're moving and getting enough exercise. And then the middle of the pyramid is supplements. So what supplements can we use to help support that? And then the top of the pyramid is some medications if we need to. But again, talking about the bottom of the pyramid, and always a basis for everything that we mentioned here is our lifestyle. So, and then in terms of that kind of rolling into preventative health. So you don't always know if you have something, right? So things can kind of sneak up. And I will tell you, sometimes I have patients come in and they're here for high cholesterol, for example, and I listen to their heart and I hear a murmur. And I'm like, how long have you had that? Maybe we should do an echocardiogram. And I kind of unveil some other diagnoses, and the patient feels generally well. And maybe that needs to be discussed further. So you don't always know. Sometimes you do. Sometimes your heart or your body will give you little clues.
Yeah, that's a good point, Ashley. I just think it's really good to do what you can to focus on preventative measures, especially with stuff like supplements. So if you know you have a predisposition to heart disease or anything like that, then you can really focus on that and take your fish oil and get your exercise in. But if you don't know, the only way to really keep up with that is to go to your primary care visits and supplement with things like extra omega-3s that aren't going to hurt you. It's only going to do better things for your body.
Yeah, that's good to know.
Yeah.
So do I need to be concerned before I start an exercise program? So say I want to start working now, I know my heart needs the workout. Can I just get out and start running? Is there something special that we should be doing first?
Yeah, so generally not. I think that if I have patients that present with symptoms with physical activity like chest pain, shortness of breath, overwhelming shortness of breath, or exercise intolerance, those are some of the clues that maybe we need to dig a little bit deeper. But if patients feel well exercising, then we don't preemptively really look into that. It's more based on symptoms. So if a patient comes to me with symptoms with physical activity, that's when we dive a little bit deeper. And then we can discuss, based on what we find, what are our recommendations? So can you do strenuous activity? Should you do more of a subtle approach, like a yoga, like maybe a chair, like some chair exercises? either way, I will say that we hardly ever tell a patient to stop moving. It's really, when we do tell patients to lay off exercise, it's really when they're recovering from a procedure, and that's only short term. So it's always recommended to do some physical activity. It's just the degree in which can change based on the diagnosis.
So that's good news.
Yes.
So I'm ready to work out, but I have to be eating right. And we talked a little bit about that. Are there certain supplements that we should take to help ensure that we have the endurance to work out, or to help our body repair from working out?
Yeah, of course. Yep. So obviously you want to make sure you're fueling your body correctly, right? I know we all love to stay away from carbs when we're trying to lose weight. Your body needs that. That's the body's energy. That's where you're going to get the building blocks for the muscle that you're trying to make when you're lifting those weights. That's also where you're going to get the energy when you go on a run in the morning, right? That's from the carbs from your meal the night before. There are multiple things that you can do to help supplement that. Of course, you can take like an electrolyte supplement either before or after you work out, if you know you're going to be sweating a lot, which that's super important, especially if you're not eating maybe as much protein as we should be. And then obviously to help support your body in the recovery process, you can take an anti-inflammatory, and a natural anti-inflammatory is a good turmeric supplement. So turmeric or curcumin acts really, really well to help the body combat all the inflammation that is caused by all the stress that you put on your muscles. If you go on a quick little walk or a run, you're putting stress on your joints, on your muscles, of course. And anytime you have any sort of muscle soreness, that is caused by lactic acid buildup in the muscles and inflammation, right? So a good way to get rid of the soreness and to help your body recover faster so you can hit the ground running the next day would be take a curcumin supplement, which I personally do, and I totally can tell you that it definitely helps. It works. It helps my soreness. And of course, the electrolytes, if you're going to be sweating a ton, and getting rid of all the natural minerals and vitamins that are in your body already.
When you mentioned to me the other day that you used, so I had gone or I done a workout and I was super sore, and you're like, did you take any magnesium?
Yeah,
And that's another thing, and I didn't even think
that.
about it. And you were like, oh, I take like magnesium and it helps me so much. So
Yeah,
it's
so
just another little
Magnesium it actually helps get the lactic acid out of your muscles. So it helps get that lactic acid that's built up in your muscles and helps push it out. So that's going to be another thing. In addition to an anti-inflammatory, that's going to really, really help your soreness if you're suffering from that. Yes.
So are these before?
I do the magnesium and the curcumin after. If you want to take it preventatively, most definitely. Like I take magnesium every night though. So that's something that's in my med packs or my little pack that I take every night is magnesium. Curcumin though, I'll take right after a workout. If I get home, I'm like, oh my God, I can't walk. I'll take like 2 curcumins. Or if I know I'm definitely going to need to take it, I'll take it before. It just kind of, I take it as needed. If you're more prone to inflammation or you're just already, your body's in a more stressed and inflamed state, then curcumin is something that you can incorporate on a daily basis. And then obviously it'll work as preventative measures if you're taking it on
So
a daily
eating
basis.
cumin, does that do anything?
Curcumin?
Regular
Turmeric,
cumin.
eating
cumin
fresh
powder.
So the problem with that is the curcumin or turmeric that we use in our food isn't very bioavailable. So we have to use a ton of it for it to take the same effects on our body that the supplement that we have does. Our curcumin is paired with some essential oils. It's a patented version of curcumin, and tons of research supporting how it supports the body when it's in pain or inflamed. And you're going to get a way bigger dose of this curcumin in one capsule than you'd ever be able to use on food. Like it just kind of overload your food. If you're cooking with it on a regular basis and using a ton of it, yeah, by all means, that'd be great. But a lot of us don't.
That's a good question.
Go ahead.
Sally, go ahead.
I was just gonna say, obviously, you're not gonna be, don't hesitate to use it because it's still good for you. But I would think that, like you're saying.
Oh, for sure.
They'd be more beneficial.
Yep.
And the amount that you.
Exactly. If you're trying to hit more of a beneficial dose for what you're trying to do, you need like a higher dose. And that's why I would recommend a supplement so you get what you need. And again, we're dosing it in a way that it's, again, a patented form. So we have done all the research to know and assure you that you are taking the right dose to help the pain and inflammation.
Now, you mentioned also, Magna, that you take like certain, like the magnesium at night, take the other things maybe the night before, or the morning of. And this is something I think a lot of us have questions about, so I'm gonna just put it out there. And that is about when you are taking supplements, whether it be your pack, the vessel pack, your daily, or if you're taking those, you know, kind of that you take maybe not as often, but you're taking them at different times for the most benefit, right?
Yes.
So that, I think some people just think that they're gonna dump them in a cup and they're gonna take them that morning and that's all they need to do.
So can I repeat the question? I'm not sure if everyone can hear us on Facebook or on Zoom, but Sally is asking about when is the best time to take the supplements? You know, taking them all at one time, taking them together. Do we need to separate them, eat them with food, without food? And so there was that question about how do we best utilize these supplements?
Yeah, so most of the supplements, especially the ones we have here, it kind of depends on really what you want to do with them. So the Monomega HD and the regular Monomega, Dr. White loves for you guys to dose that in the morning. So that's something that you would take in the morning. The vitamin D is something you should take in the morning too, right? Because you're naturally, your body is going to wake up and you're going to go outside and feel the sun on your body. That's not something you're going to take at night because that vitamin D is going to help promote energy synthesis, right? So vitamin D is going to be something that you would want to take in the morning. Everything else, like I just touched on, like the curcumin or even the electrolytes, that can be as needed or just kind of wherever it fits. There's like a multivitamin I put in the morning, my probiotic I take in the morning, but you can take those kinds of things either at night or in the morning, it doesn't matter. There are some things that need to be taken apart from food and with food, but all of this basic like minerals, omega-3s, it can be really taken kind of whenever. So I have mine split up into like morning and nighttime.
So I'm wondering, you said, okay, so you come home from a workout and you're sore, and so you'll take the curcumin or the turmeric. How soon does that begin to relieve that pain?
So that's a good question. If I remember to take it, or if I know that I'm going to be sore in the morning, I'll take it right away. And I usually don't get sore. Again, I am taking magnesium on top of that. So every single day I'll take like 2 of these magnesiums. But if I worked out really hard and I know I'm going to be sore, I'll take another 2. So I'll take a total of 4 and like a couple curcumins, and I'm usually not sore the next day. So, and I mean, that's just how my body's been responding to the supplement. I do take these things on a regular basis. So if someone's body is more depleted, more inflamed than mine, just you have more chronic pain, it might take a little bit longer for these to take effect. It really depends because this is natural stuff. We're not over medicating you guys with pharmaceuticals. It's all natural stuff and your body's going to respond differently. Everyone's body responds differently.
What dosage of magnesium do you take?
The dose of magnesium, you know, dose of that, honestly.
I want to say 125 milligrams per capsule. No, 250.
Well,
What is that?
no, so there's 828 milligrams of magnesium malate, and then the malate and chelate, or malate and glycinate is 250 per 2 capsules. So I take double that. Yes,
Yeah.
yep, we do carry a powder form as well, or you guys carry a powder form as well. And that's more magnesium for the brain. So that can be another topic of discussion.
Yeah. Yes, I know.
So how many milligrams would you figure that out to be? Is that like 1,000?
So it's a little bit over 1,000. Yes, ma'am.
And with magnesium, there are, like you mentioned, there's like, isn't there like 3 or more?
There's
3.
like 6 different forms, but there's only 3 real beneficial ones. I guess there's probably like 4 or 5 beneficial ones depending on what you're really using them for. But if you want to use them for muscle soreness, you need malate and glycinate. The brain magnesium is L-threonate, and then if you're using it for stuff like constipation or to help with your bowels, it'll be citrate usually. So
And that's the most common one that you'll find, but it's important to know that there's different types of
right.
magnesium.
Because you may be taking the wrong one when you're taking it.
Yeah.
Yes.
Which is the best one for heart health?
Heart health is going to be this optimal magnesium. So it's going to be the magnesium malate and glycinate, and that comes together in this. And that's why it's hard to know when you go like buy just a multivitamin from the grocery store. A lot of times, all these companies use the cheapest form, which is going to be citrate or oxide that do nothing for your heart, nothing for your muscles. It's, I mean, all filler essentially. So.
What was your question, Mark? Sorry, I think you.
I was asking, I heard some people take a dosage of magnesium does go diarrhea. Is there a balance that you have to sort of achieve? The right kind of that gives you,
I honestly have never had any issues with that with this magnesium. So magnesium citrate is going to be the magnesium that is going to cause a loose stools essentially. So the malate and the glycinate, I've never found that to be true. That shouldn't be what happens there. But with citrate, there's a different form of magnesium, it's different chemical structure, that'll happen for sure.
I think it, I was going to say, so I wanted to repeat. So the question was there a certain amount that you could take of the citrate that you wouldn't have such severe loose stools?
And if this one would maybe like cause that. essentially.
But I do think if you are taking it for that reason, you would just back off a little bit until it got to the point, because we're all different, right? And maybe what's good for me might be different for you, so.
Yeah, I have patients too that'll come in and they'll be like, I'm on a magnesium citrate. And I'm like, what do you take it for? But they'll have constipation, right? So that's truly what they're taking for and what it's best used for. I will say that our optimal magnesium is probably one of our top sellers in the clinic. I have a ton of patients that are on it. I think I've heard of maybe 2 patients say that they've had diarrhea. And then it's kind of hard to decipher if it's really from the magnesium, was it something else? And so, but I generally just say, you know, why don't you just try to stop the magnesium and see if that resolves your symptoms, and then go back on it if you feel like it was related to something else. So I don't really hear diarrhea or loose stools, I should say. Maybe that's more professional. Sorry, I'm a nurse, so sorry about that. I'm a nurse, I'm gonna just use the word. Anyways, so if that helps to answer your question.
So what would be the maximum amount of that particular product that you would take?
I don't know the answer to that question. I can definitely find the answer. I'll just go look through the research that we have. We have extensive research on all of our products. I've never been asked that question, but I can figure it out for you.
So most of your products do actually give a, you know, like a suggested.
Suggested, yes, of course. Yeah, so it's suggested and talk to your practitioner if the treat is, because some just depends.
I think I've had like maybe, I think 4 capsules is probably the max that I've had anyone take.
Yeah, I wouldn't take more than 4 at
Yeah.
a time. Like I wouldn't take more than 4.
And you were doing more, but you were breaking it up too.
I was there breaking,
Right.
yeah. So I take like 2 like right after I worked out, and then the 2 just at night.
And I should know this, but I don't. Is it water soluble? Is it something that your body will eliminate, so it's okay, it won't build up?
Yeah, so it's something that'll go out. And the really, really important thing about the magnesium and the optimal magnesium, it comes from Albion Labs. Albion Labs chelates a bunch of minerals, and we buy all of our minerals from them. Chelating or chelation means essentially, in this case, that we're putting an amino acid group on top of that magnesium. We're attaching a protein group onto the magnesium mineral, so that when you ingest the magnesium, your body and your stomach sees it as a protein. So it's going to ingest it readily. It's not going to just pee it out. You're not just going to get rid of it. It's going to actually use it because it's able to ingest it, because it's like, oh, hey, there's a protein, because it has that amino acid group on there. So that's why it's important to take a good quality supplement and know what you're taking.
not to be magnesium to you. Does magnesium promote or disrupt sleep?
It promotes sleep.
Allows you to rest.
Yep.
Yes.
We use it for so many things.
Oh,
gosh.
magnesium is important for more than 300
Oh, yeah.
enzymatic reactions in your body. So that's one of those things that if you're not supplementing with, you probably should be, because we just don't get enough magnesium in our diets
And as
as it is.
age, we don't,
Mhm.
we don't hold on to it as much as we used to.
It's very important. It's a vital.
Yeah, it's very, very important.
Magnesium question. I'm taking the Neuromag over the brand.
Yeah.
But can you take, and it seems like for different, can you take too much, like you take older, water, how does that?
So the Neuromag is a very small dose of the malate and the glycinate. So I've taken both at the same time before. I kind of switch it. Like this month I'm doing more, because I put in my pack, I put those magnesiums, but there are some times that I'll do like, I have a bottle of that magnesium, so I'll put like 1 capsule of magnesium, but I'll take the powder as well. So it just kind of depends. That's in the Neuromag, there's not a very high dose of the malate and the glycinate, so you can take like 1 to 2 capsules of the optimal magnesium in addition to the Neuromag, just because the Neuromag doesn't have a high enough dose of the malate and the glycinate to really do what you're wanting it to do, if you're wanting it for cardiovascular health or, I mean, sleep, anything really.
So we're talking about a healthy heart, and one of the best ways to keep a healthy heart, and we'll get it out, is to move. So we're going to move a little bit. We've been sitting for a little bit, so let's all stand up. I see some of you have your coats on because it was chilly out there. You can make some room. And we're just going to do movement for 1 minute, and you can time it. You can watch me to keep me on track. But you have a couple choices because we all have different abilities. You can march in place with those knees super high, moving those arms. You can do jumping jacks for a full minute. And so we're going to go. Okay, I'm going to give you 4 seconds to get ready. So jumping jacks are marching high, and 1 full minute. Let's go. Woo, let's get that heart beating. And you know what? Let's think about it, right? My heart is pumping. I feel good. I'm going to need some magnesium after that. I'm going to sleep really well. That was 15 seconds. We got 45 seconds to go. Now remember, you should be moving your body and creating this pumping heart every day. That's how our heart stays nice and strong. All right, so we're still going. That's 30 seconds. You guys have got this.
Wow, we're not going. We're the
Keep
old
it
lady.
going.
I already did yoga today.
Yoga is great for stamina, breath practice. This is really cardiovascular. This is how we build that heart. We've got 5 seconds left. Sally, you gave up? No. All right. Woo. Take a deep breath in. How do you feel? That was 1 minute. 1 minute of movement.
Are we sitting down?
You're sitting down. Thank you. Thank you. Thank you. Every day. So Sally just said I should do that for my guests. And we are actually starting a new program. I gotta catch my breath. And it's called, what is the Midday movement?
Midday, yeah.
And so every day, Viola's gonna go on and show you some movement at your desk. And this was 1 minute. You have 1 minute a day to give to your heart, right? And so you wanna make sure you're doing that. All right.
Like just 1 minute.
So we're putting together some of the ATP energy because you just worked your body, right? And so we already learned that we want to make sure that we're staying healthy and that we're giving our heart and our body the energy it needs to keep it moving like this.
We're afraid we won't be able to sleep.
I understand. Yeah.
Was it just electrolyte? Is it just gonna be final?
All right. So as we're passing this out, Magda kind of mentioned something that we want to move into next, and that's stress. So when you think about heart health, one of the contributing factors to heart disease is stress. And we've all had stress in our life, right? And so I have some research. I tried to do some of the recent research, and it says that during stressful times, the body goes into fight or flight mode. And this increase in the hormones, adrenaline and cortisol, it increases our blood pressure, and it causes the body to move into that sympathetic state. And it's on that high alert. And we're seeing that it's associated to cardiovascular disease, heart attacks, stroke, obesity, and anxiety, and depression. So when we're looking at taking care of the heart, we have to manage our stress. And a lot of times when you hear stress, you're thinking stress like, oh, my boss is always on me, or how am I going to pay the house bill? And these are stresses that are in the environment. But when you're exercising your body, that causes stress too. Some of the stress is good, but if we overwork our body and we're not supplementing it, or we're not bringing in, healing foods, we can cause additional stress. There's other ways that we can be stressed too, and that's from environmental toxins. And so we have to look at all of that when we're looking at taking care of our body. And so we're going to talk a little bit about stress as I catch my breath.
I know you did that. So what I could talk a really long time. I'm sure you can too, because Denise
We actually have a
did
stress
series.
yeah, series, yeah.
Yeah, so, kind of, talking more about the preventative side. Here at Vessel Health, we do something called digital pulse analysis. And what that measures is it measures your heart rate variability, but it gives a bunch of measurements, but two of the measurements it gives, which is interesting, is it looks at our sympathetic and our parasympathetic nervous system. So it's measuring the fight or flight, which is your sympathetic nervous system that Denise just talked about, and then your parasympathetic or your rest and digest state. And sometimes we see, that one's a lot higher than the other, and more often than not, we're seeing a really high sympathetic nervous system reading and like a really low parasympathetic. And really they should be evened out, if not, opposite. And so when I see that, I can tell that that patient may be in more of a stressful situation, or just have a lot of like adrenaline that they're exposed to. And so then we talk about how that can impact the heart, and then ways to reduce that. And a great way is meditation or yoga. I always recommend that for my patients if I see that. And we do worry about that. If you have over time an overreactive sympathetic nervous system, it can lead to stress of the heart. That's just it's just very basic. And so paying attention to that and knowing that information can help us then in our treatment options and our therapy options. And it all boils down to lifestyle, a lot of it.
So I'm going to have you make a fist and hold it as tight as you can. And as you're holding the fist, we're going to let Magda share a little bit about the supplements that help our body ward off this stress, right? What do we do for our bodies when we're under stress? Because there's supplements that we can take in addition to the yoga and the meditation. There's supplements that we can take to help our body.
So obviously,
Hang on to that fist.
to kind of second or third, I guess, of what Denise and Ashley said is that exercise, yoga, meditation are definitely going to be my go-tos for stress. After that, though, if I do need to support my body, or if I need to recommend to anyone, although this is what you should do, I always go for the anti-inflammatories, right? So the Monomega HD is an omega-3 fish oil, which is amazing for supporting the body and providing anti-inflammatory effects. Again, we're going to go for that turmeric complex is going to be really good at providing the body with what it needs to become less inflamed, essentially. There are several other herbals and just different supplements that we can use, but those are usually my top two go-tos for sure.
So the reason I have you holding this fist super tight is this is what you're doing when you're living a stressed life, right? You're so tight, and after a while you can't hold this anymore, and that's what happens to your heart, right? Eventually it gets to the point that it's just worn out and it just can't continue. And so we have to give it a break, right? It's okay to hold that fist tight, but like Ashley said, you have to have that balance. Sometimes you have to rest, and then you can hold it tight again, and then you have to rest. But you have to have that balance. If you're like this the whole time, eventually something's got to give, right? And so this is just a good reminder that we can't live in this tight feeling all the time.
You talked about exercise. You talked about exercise. Sometimes you can actually exercise too much, and it can create stress on the body, and that's actually very true. And a lot of people don't realize that. So for example, sometimes we see a lot of our professional athletes who have actually overworked their heart muscle. So that is a thing, and it's really induced by the strenuous physical activity that they endure through their professions or whatever it may be. And so we see that the ventricle, the left side of the heart, the muscle there, can actually become thickened. So think of it as like working out your bicep, right? So you're working out that muscle, and that muscle gets bigger. well, things like high blood pressure and working out too much. And I'm talking about like, I'm not talking about you,
Right.
yeah, like in patients that do this constantly, you can thicken that muscle, and then the heart is not able to beat or pump normally. And so then they can have some issues. So not to, I mean, this isn't trying to say don't exercise, right? Because this is what we're trying to promote. But I just wanted to share that little, that little fact that actually we can really work our hearts out too much.
If we don't have that balance.
Right. Exactly.
Nice. Right. So we're going to do another exercise, and don't worry, you don't have to do jumping jacks for a minute. This exercise is to bring our bodies into the parasympathetic, and it's super easy. And I had Harriet and Mark in my stress reduction class, and so this is going to sound familiar, but you can bring your body into parasympathetic, into that rest and digest in just a moment. And all it takes is your breath. And so I'm going to have you place your hands onto your heart. And there is actually research now that shows that when you place your hands onto your heart, there is this comfort of just bringing that sense of calm that brings you right into parasympathetic just by putting your hands on your heart. And we used to do this. I think naturally we just kind of touch our heart sometimes, but through society, we learn not to do these motions, right? But just this is comforting. And we're going to take a deep breath in through the nose, and we're going to exit, or we're going to exhale with a hum. And so my lips are going to be closed, but my teeth are going to be parted. So I take a deep breath in through the nose. As I exhale, I hum. Oh, you guys sound so beautiful. When you do that, you create nitric oxide in the frontal lobe of the brain. People are paying to have supplements of nitric oxide, and you can make it yourself. Nitric oxide moves you into parasympathetic, allows the body to rest, allows the body and the heart to heal. So we're going to do it 2 more times. So take a deep breath in, exhale with a hum. Someone's got a nice breath there.
I know.
I'm just like, another deep breath in.
I really love it.
And out. Nice. And naturally, just kind of close their eyes or relax, right?
Like
Just-
that.
Is that what they do at home?
It is. So Om is the internal, the hum is the internal Om, which brings a sense of calm. It is the sound that is most in balance with your inner being, is what Louise Hay would say, but it's what is most resonant with you. And so hopefully you feel your body just relaxing just a bit. So if you're ever out and you're feeling stressed, your boss is yelling at you, that car cuts you off, whatever life, sends your way, it's so simple. Place your hands on your heart, deep breath in, and just let it go. Nice. All right. So we've talked about exercise. We've talked about working hard to reduce stress. We're going to move into diet next, because this is something you have control over, right? So we've heard a lot recently about epigenetics. So epigenetics says that you're born with certain genes, right? So Magna talked about a predisposition for heart disease, but we're finding now that a lot of times these aren't something that you inherited. Well, it might be, but it's not genes, it's practices, right? We're eating the same foods that our parents ate. We're practicing the same way of life that our parents did. We're living in a society that's full of stress, and we're not, doing what we need to do to stay healthy. We can actually shift our health by eating good food, good, healthy food. But we also know that good, healthy food isn't as easy to come by as it used to be, right? Our fields are being depleted, so a lot of the foods that we eat aren't as substantial as they used to be. They're not full of the nutrients. The research that I found here found that walnuts are wonderful. A half a cup of walnuts can lower your LDL. Walnuts are in particular are associated with lower rates of heart disease and stroke. Eating ginger, ginger lowers the LDL and cholesterol. It has also found that some 2 grams of raw ginger a day reduce exercise-induced muscle pain, which is why it's in here, right? What else do I have? There's a nice article here, and I can share this. I actually got this at Natural Grocers and has a lot of research. But one of the things it talks about is omegas are wonderful, and you can talk about the foods that contain omegas, such as chia seeds and salmon and a lot of the nuts. But foods that are full of antioxidants. And so we have berries up there. We have pomegranate juice up there. These are wonderful. We have dark chocolate up there. These are wonderful for heart health. But we also know that eating healthy, although it sounds easy, isn't as easy as it sounds, because there's fast food up and down the street, so you can't find it, or the foods aren't as full of nutrients as they used to be. So
we were talking a little bit before too. So of course, ideally, we would love to get all of our enough vitamin D and enough omega-3 and so on and so forth from our foods, right? That's what we would prefer, or I would prefer as a provider or practitioner. But sometimes we just don't get enough. So vitamin D is a good example of that. We were talking about that, like I said before, this class. And so it's okay to supplement if you need to. And sometimes it can be overwhelming to think, okay, well, the walnuts have enough of this. I need to do like a cup full a day, or the berries have this, and I need to do, 2 cups of berries a day. And then you're almost overwhelmed, and it can be a burden in a sense, to try to remember to do all that and get enough. And so vitamin D, like I mentioned, is just such a good example of that we may not get enough from our diet. We would love to be able to, but sometimes we can't. So we need to take a supplement. And we're very deficient in vitamin D.
Oh yeah, to piggyback really quick on that vitamin D statement. There's a lot of reasons why you may be deficient in vitamin D. One of those being genetics. Your body just naturally can't convert the vitamin D that you're kind of getting from the sun. You just can't do it. Another reason might be that you are deficient in magnesium. If you're deficient in magnesium, your body cannot convert what you're getting from the sun into vitamin D. So those are 2 of the many reasons that you might be deficient in vitamin D. And vitamin D deficiency can be detrimental to your heart health, to your mood. It can cause depression. It can cause a multitude of symptoms that might leave you feeling kind of, I don't want to say like depressed, but I mean, essentially it is like if you have a vitamin D level, usually I like to say below 30,
right?
It is. Yeah. You're just sad. Like you're very fatigued. Like you don't want to eat. Like all you want to do is just be sad. And it's unfortunate that so many people, and I mean, modern medicine practitioners are just prescribing an antidepressant. And it's like, wait, hey, check your vitamin D. And I mean, I have friends
your body's
that
not lacking those pills that you get for antidepressants. Your body's lacking nutrients.
Yeah, exactly. So vitamin D is very, very, very essential for kind of all over health, just like magnesium. It's one of those things that we need.
Is it D2 or 3?
D3. K2, D3. Sorry, that's why I got you.
Yeah, there are 2 types. So there's vitamin D2 and there's vitamin D3. And in terms of a vitamin D deficiency, you should always take D3. But if you have a parathyroid disorder, for example, then D2 is typically recommended. But in terms of depletion, like you get vitamin D levels checked and your vitamin D levels low, you should always supplement with D3. And do you want to talk about the K2?
Yes.
I think D3. It's D3. All D3. Yeah, D3, and then K2. You might see, I don't know if you can see this, but this says K2 and Magda. We'll talk about that because many people don't know about the benefits of that.
Yeah. So, and Kevin had a question. I don't know if you want to get it before we.
So to get a little bit better towards food, I found out I had sort of a heart problem about a year ago, and I changed my diet completely. I've already lost 20 pounds, and now I'm too thin. So is there something I can do as a supplement will help me build up my bulk and absorb and utilize all the vitamins and minerals I'm getting to increase my weight?
So do you think you're lacking in muscle? I
I'm
mean,
losing muscle, yeah. for sure.
He stopped eating meat and eat it right away, and I think that,
I'm
oh,
back eating some meat, but I still am losing. Maybe I'm doing, I have this like double brand muffin that I make. And it's really great. And then maybe that's helped me lose a lot of weight. But,
The fiber.
Yeah, the fiber, lots of fiber. Maybe I'm doing too much. Is that?
so the question was, that you were diagnosed with a heart condition, correct? And he changed his diet and he lost weight, and now he's thinking maybe he lost too much weight. So is there something he needs, to supplement with, or a way to regain, muscle, healthy weight,
he
right?
also had high cholesterol, really high.
But my diet changed. My cholesterol fell way down.
Yay.
It's amazing, and that's all lifestyle, right?
Yeah.
That's what this is.
Suddenly diet too.
Oh, yeah.
Food.
Yeah. Yeah, well, and that goes.
Not so much anymore.
So, a couple of things I think about that. So I will say, in terms of like your height and then your weight, and we use these, these scales and check your BMI, and
We should recommend coming in and doing
the
Tanita.
Tanita, yeah. So we do a Tanita, yeah, and we can talk about that really quick too. We do a Tanita testing, so it measures your body fat, your visceral fat, and measures your body, your water weight, and it measures your muscle mass. To see where you're disproportionate, like do you have too low of muscle mass and maybe too much body water, for example, and how do we change that?
Then we can be more individualized in your care.
Absolutely, yeah. And I wouldn't worry about you being really too thin necessarily. In terms of the muscle though, and keeping your strength, that's important, especially as we age, and keeping your bones healthy, right?
Yeah.
Because we lose a lot of calcium as we age, and that's important. And vitamin D helps us to absorb calcium. So vitamin D is not a vitamin, it's a hormone. So anyways, we can talk a little bit about that too. So if you're a plant-based eater, and you need to increase your muscle mass, then maybe it's getting a little bit more protein. And that can be supplemented with like a vegan protein if you want to stay vegan or vegetarian. You don't necessarily need the meat to do that. You can supplement with a simple protein shake.
What do you think about those protein shakes that are so ubiquitous?
Which ones?
Well, and sure, rice.
Those have a lot of sugar in them. Yeah, so they're not a good choice.
I keep looking at your niece. I'm like, am I saying the right thing? Yes, exactly.
Can you clarify?
Yeah.
Or, just get both of them.
Yeah,
So there's
Magda
some
can talk
great
about that.
proteins out there.
Yeah, there's a lot of great vegan proteins. We use all of our protein shakes are vegan protein. We stay away from the whey proteins and and then we don't use,
Those are allergens and inflammation.
Yeah, it's super clean. And there are some products over the market or over the counter, I should say, that are good options, but that's where I would start. Definitely is you're getting enough fiber. That's important. And protein, adding more protein may be best to give you number one energy and be able to build that muscle mass.
What about fats, like coconut oil? Is that good for
Absolutely.
high cholesterol?
So fats have a bad, fats get a bad rep, right? So years and years ago, we used to say, don't eat fats anymore, right? It's terrible for your cholesterol. And then a bunch of research came out when they compared patients who were eating fats and not eating fats, that actually didn't make a difference. So it's just the type of fat that you have to watch. Okay, so fats are good. We need fats in our diet. Like, please don't do a no fat diet. I'm saying that for everyone here. We need fats and we need the healthy fats. So the avocado, the avocado oil, the olive oils, to do, nuts, seeds, and we can talk about when oils are best used in what situation.
Is coconut oil good or bad? We heard both.
Yeah, so coconut oil, it could be good in certain situations. It just has some higher saturated fats than some other oils. So that's what you have to watch is your trans fat and saturated fat. So when I say like, don't avoid fats, don't go out and eat like fried fatty foods, right? So we still have to be careful about the types of fats that we eat. It's the saturated and trans fatty foods that we need to really watch, and not really so much our unsaturated fats that are in a lot of our healthy foods. Ghee? Yeah, the substitute. Yeah, so ghee is good, or I think still, I don't know, that there's so many, I will tell you in general, there's so many things that come out that are like, this is good, like eggs, for example. Eggs are good, no eggs are bad, no eggs are good. I don't know, do you have something to say about ghee?
Yeah, for me, I think ghee is great
Yeah.
if it comes from grass-fed cows. That's the big thing. So if it's coming
It's
from,
condensed.
yeah, well, if it's coming from like non-grass-fed cows, then you're gonna have higher omega-6s in
Yes.
the ghee or the butter, and so there's not, you don't want to have too many omega-6s.
Right.
If you're coming from grass-fed, and it'll say labeled specifically if it comes from a grass-fed animal, you'll have higher omega-3s, which is really what we're
Yeah,
going
you
for.
need a good balance. You need more omega-3s than omega-6. Omega-6 can be pro-inflammatory. We can get it. I mean, there's so much, right? It's like, oh my gosh, overwhelming. But yes. So, and then there are other, plant-based butter options. And I mean, I'm plant-based, and Denise is too, and I use plant-based butter. Do you use plant-based butter?
I actually, because I do Ayurveda, I actually do ghee.
Oh, do you?
Yeah.
Yeah. So, but anyways, there are options, and just keep in mind, really read the labels, because there are so many fillers and, oh my gosh, junk in your food. And so that's important.
And if you would like, we can help you create meals that are healthier. We can teach you how to make your own ghee. We can teach you how to cook with these healthier oils. We could do classes like that.
Yeah. Do you want to speak about the protein?
Yeah,
because
so
that's like
that's this.
And we haven't touched on the K also, which we were going
Yeah,
to.
oh,
I'll go
yeah.
back to that too. But the protein, again, back up to what Ashley was saying, like, I don't, obviously totally individualized on like your weight. And if you feel like you need to gain more weight, if you feel like you're eating a lot, can't eat anymore, a good way to substitute is with a protein shake, especially if you are losing muscle. That's a sign that you need to be ingesting more protein. So maybe switch out some of your like fats and eat some extra protein, like eat like less avocado and like extra chicken, for example. If you want to supplement with these shakes, like this is a really, really good way to get some extra vegan protein in there. It has tons and tons of nutrients, lots of vitamins, minerals, lots of things that are really good for your gut to help promote detox and just things like that. Also has overall, I'm sure you've heard everyone just talks about like your macros. So your protein, your fat, and your carbs. This has a really good balance of the three of those in addition to other nutrients that you might need. So going back to like the Ensure protein shakes, all of those are, highly processed. It's really, really, really hard for me to say like, oh yeah, just go drink a protein shake, go buy a Muscle Milk, because they have tons of sugar. And don't get me wrong, like when I was in college, when I was younger, I definitely would drink those because that's what I could buy in the student union building. Like that's what was there. And I was like, okay, I need a quick snack. Like I'm not going to go buy a bag of chips, right? So I'm going to buy Muscle Milk, loaded with sugar, loaded with chemicals, processed fillers, everything. So it's just really, really hard for me when people are like, oh, I'm losing weight and this and that, but they are drinking all these protein shakes or even protein bars that are just full of chemicals. And a really, really good kind of rule of thumb is if you can't pronounce the ingredient on the label or you don't know what it is, don't buy it. Obviously I know everyone harps on organic things, but if it's certified organic, it's not going to have high fructose corn syrup. It's not going to have all of these random chemicals that we don't necessarily know to stay away from, because we're just taught in modern day culture and in our society that, oh, this is cheap. This has this much protein and 0 carbs and 0 fat. So I'm going to buy it because it has 25 grams of protein and no carbs, no fats, right? But we need the carbs and the fats. We need all of it together to build a healthy lifestyle and a healthy body.
And eating unhealthy, not eating organic foods causes stress on the body too.
Absolutely.
Yeah, because now the body, instead of healing, is having to get rid of all of that. It's having to work at that. So sorry, Mark.
No, for decades, I have heard the amount of protein an adult needs. That changes through aging. But if they're not on the know, but I've never heard of an American being protein deficient. So how much protein, in your opinion, because everybody's got a different. How much does,
Especially a senior.
yeah, I mean, for our demographic, how much protein do we need?
Yeah, so I can touch on that actually, I'm sure you have something to say, but, I guess it depends on.
She always has something to say.
It depends on, I mean, your goals, like, and I don't do like this extensive research on how much protein each person, like what life area they're in, I guess. I tend to eat a lot more protein just because if I'm working out and trying to build muscle, like I need more protein to help encourage my body to build muscle. So I probably eat more protein than an average adult should or is recommended to. Because again, if you're just trying to maintain muscle mass, if you're not trying to gain muscle, there's no reason for you to be eating more than, what is it, 10 to 15% of your calories of protein.
For protein,
Yeah.
I don't know.
I don't know the exact
I
number.
don't, yeah, but I know that I think it's usually based on your, so it changes because it's based on your weight too. So it's like weight times something. I don't know.
And Mark is
It's 30,
vegetarian
20.
also.
Yeah.
I'm trying to think, I think it's carbs and protein are 30 and the fats are 20.
Yeah, and that's my split, but that's.
You mean
It's
a
like
day or a meal?
That's the percentage, so.
Percentage of.
Yeah, that's so,
Yeah.
of each. So it's, think about your daily, calorie intake,
Oh,
20% proteins, 30% carbs, or 20% fats, 30% carbs, 30% proteins. Did I do that right?
We're missing 10%.
I
I think it's, what is it, 35, 35.
That's right.
35. That's my split, but I just feel like that's a ton of protein, because that's, I
That's kind
mean,
of just the standard.
right,
and
yeah.
20 is definitely fat.
Yeah, for
Good
protein,
math.
I've heard somewhere around 20 per meal.
Yeah, we
50 or
read
60
that
per
too.
day.
Yeah.
Somewhere.
In terms of what you mentioned, Mark, so, no one's ever really deficient in protein or no one's ever died from protein deficiency, right? There are patients that because I measure typically like a comprehensive metabolic panel, which breaks down your protein. And there are times where I have some of my elderly patients that are a little deficient in protein. And so I take that information and I'm like, maybe try, because sometimes we don't, especially my like frail 80 or 90-year-olds, they just don't get enough protein. So I try to encourage that. It's important. It's important for many things, but it's not something that we need to, I guess, focus solely on, right? It should be a combination of various things that helps.
Proteins are just about every food.
It is. It's
Lots
in
of
vegetables,
vegetables,
it's
yeah,
in
right,
grains,
And
it's
I
in.
know with my situation that, I was actually told to reduce my amount because it was, dangerous for me.
Mhm.
I mean, the kids.
And yet, when I have my blood work done, and it's twice a year, they always check my protein and it's right in the middle.
Yeah.
Yeah, but I drink not that shake, the other one,
Mhm.
but I'll just do like one scoop. And that does the trick, yeah.
Yeah, I do that too. Because I'm vegetarian, so I do think about protein a little bit and I try to incorporate that. And when I know I'm not going to get enough for my daily intake of, fruits, vegetables, grains, then I will substitute with a shake. And I usually do a shake for breakfast, and I add tons of chia seeds, and you can add the harvest greens, which we haven't really talked about. I mean, you can really bulk it up and get a lot of nutrients from that. So yes, yeah, a lot of good stuff.
Yeah.
Mhm.
Yeah.
Yep.
Hemp is one of
Hemp
it.
hearts, I love hemp hearts. Oh my gosh.
You love what?
Hemp hearts.
Hemp hearts. And hemp milk is a good way to add additional protein
I
too.
put powdered greens in mine.
Mhm. Yeah, and that's this too. The harvest greens are like a powdered green. Did you want to talk about the K2 really quick?
Yeah.
And then maybe
Yeah.
talk about herbicide? Sorry.
30, so we.
Oh, yeah.
Okay, let's
okay,
wrap
I'm
up.
sorry.
Really quick, K2 is needed, so vitamin D is ultimately going to produce a lot of calcium in the body, but if you don't have something directing where that calcium is going to go, it ends up in your heart and your arteries. So that's why a lot of times there's a lot of plaque buildup in your heart or in your arteries, because you may have been supplementing with vitamin D, or for whatever reason you're just deficient in K, so the vitamin D that you're getting from the sun, it's just causing a calcium buildup in your heart, which obviously is a problem. So that's why we pair it with vitamin K, because vitamin K is going to direct that vitamin D to, or I guess the calcium to your bones. So that's why it's really important that if you are taking vitamin D, especially for bone health, that you have vitamin K with it. You do, just a fair warning though, if you are on a blood thinner, K2 or vitamin K can be, or can interfere. There is, I mean, I guess it depends on the research, depends on the person, depending on the dose. Because I mean, I know some patients that are on like MK7, for example, which is a different form of vitamin K than this, and on a blood thinner, and it hasn't seemed to affect the
It's
blood.
more
at
for
all.
like Coumadin. If you think of, if you're on
Yeah.
Coumadin, so those are our Coumadin patients. So it's not the direct oral anticoagulations like Eliquis or Xarelto. It's the Coumadin, which is the, excuse me, vitamin K antagonist. So if you take a vitamin K, when you're taking Coumadin, you're supposed to avoid vitamin K. And we talk about really getting that from your foods, right? So your green leafy vegetables, so on and so forth. So in terms of prescribing or suggesting a D3K2, that's something I always ask, or no, if, you know, if that's my patient, like, are you on Coumadin? Okay, you're not, so you're good.
So what if we're taking an aspirin every other day?
That's fine.
The
It's not
aspirin's
gonna
fine,
interfere.
it won't hurt.
No.
Okay.
CoQ10 also has a very, very similar structure to K2, which acts the same as it can affect or impact the effects of the Coumadin. So that's something that I would either stray away from or just work very closely with your primary care physician to make sure that the vitamin K or even the CoQ10 is not acting as something detrimental.
So I know that today we're here to talk about heart health, but everything that we've been talking about is also recommendations to keep our immune system strong in order to help keep us safe from the COVID virus. And so all of these are going to help, whether you think, well, I don't have a heart concern, I don't need to do this. It's actually going to keep your immune strong. So.
Yeah, so these, I mean, I can go really in depth with you afterwards if you want, just so I don't have to spend time on the video, but Vessel has 3 different shakes. One is meant more for detox, one is just specifically like a protein shake, and then one is geared more towards diabetics and someone looking to lower their A1C. And those are the 3 different ones that Vessel carries, and I can go through the 3 with you afterwards. Yeah.
So we have a couple people on Zoom. Jean and Nikki, do either of you have any questions before we sign off and let you guys go?
No, thank you.
All right. Well, are there any other questions? And then again, Magda's here if you have any specific questions afterwards. You're welcome to come up and look at anything. If you want to ask myself or Ashley any questions, we're here.
Also, really quick, one thing I didn't mention at all.
Oh, yeah,
I
we
know
do
I
need to
mentioned
talk
it
about this.
personally is the pack. This Vessel pack has all of these things in here, perfect for everyday wellness and heart health. So these Vessel packs and the advanced Vessel packs are a really, really, really good way to get your supplements in, so you don't have to worry about eating the right things. And it
Or
has
buying them
Or
and buy them
yeah.
individually. So you're
And it's
not
all
opening
done for you.
6
So.
different bottles. They're all individually packaged little packets, and the supplements are inside. So this is a really good way to do it, and they're pretty cost effective.
Yeah. And so, and we have been here at Better Health, we've been working on doing a special program for people that have had COVID and they're worried about their recovery. And we're going to create a special Vessel pack for that too. So,
Wow.
all right. Well, thank you, everybody.
Thank you, everybody. And thank you, Viola. I know you've been on Facebook with us. We miss you. And thank you, and thank you,
Thank you, Nikki.
Jean. And I wanted to also mention, next month, March, we're going to have another our Healthy Living series will continue with some more very dynamic speakers and events. I'm really looking forward to sharing all that with you. So just to give you a little teaser, we are going to have our March Mindfulness. And so it's going to be more about the mind and obviously, you know, some of the things that Denise had kind of brought up tonight with our panel about ways to, you know, kind of calm and distress ourselves and a number of different things. So thank you all again, and we're happy to see you and have a wonderful evening.
Thank you.